Dr. Jaime Taweel joins us, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, welcome back to the MegaCast.
Thank you for having me. How you doing?
Good, good. An extra, just quick thank you. Jeff, the producer of the show, had some terrible incident in his backyard. I told him to be careful and severely sprained his ankle. Is he doing okay? I know you've been talking to him. Thank you.
Seems to be doing okay. I think he's taking it easy for a little bit, and if it doesn't get any better, we're gonna have to get a little bit more in depth as to what's going on exactly.
All right. Well, we'll check in. We're going to, Jeff. I know you're listening, so at some point, maybe after this interview, we want to see that ankle on the broadcast today. Make sure it's okay. I'm not going to make you do a diagnosis, Dr. Taweel, over Civic Center TV and all of our other television outlets, but we'll want to make sure he's doing all right. And there's a pretty good example. I mean, some non-coronavirus incident happened. He picked up at first he just called me and I said, well, I can't do anything for you. What call Dr. Taweel. So he called your office and you did some telemedicine, right? Is that what happened?
I believe so, yes.
Yeah. All right.
Just quick, got some photos. We're able to kind of do a cursory exam.
Yeah. So, and then you talk to him, and if he needs to come in, you'll know in a couple of days, and if he's okay and he doesn't. Is that what's happening an awful lot? Are people, because some people are afraid to pick up the phone or come see you.
Understood. I think the big issue is that a lot of times, getting a telehealth call can really give me an idea of whether or not it's something that needs to be seen versus something that can wait a little bit longer. Do you know what I mean? Oftentimes when patients are really concerned, they tend to sit on things because they're afraid that if they don't see me or if they do a video call that, it's not going to get evaluated fully. But the reality of the situation is that when we do those video calls, we're able to at least discern whether or not it's a complete emergency versus something that, hey, you have a little bit of time. So if you do have some concerns regarding COVID, you can wait on it a little bit. And if you do wait, these are going to be the consequences of that.
Well, I'm really encouraged by the testing we're seeing. I don't know if you have time every day to go in and look at the Oakland County testing results, but at first it was really hard to decipher what was going on because we started doing a lot more testing. And then, of course, there's going to be a few more cases that would pop up. But overall, they are now publishing the percentage of positive cases that are happening. And we're seeing that number is pretty much under control. It's like in between 7 and 10% most days. Is that good, bad? Where are we? What do you think?
Obviously, you want to get it as good as possible, but it seems to be leveling off to a degree, and that's positive. So I think that the social distancing is working. We are flattening that curve. We're not reducing the amount of cases so much as we're just kind of spreading it out so that we can not overwhelm the system, if that makes any sense.
It makes perfect sense. And right now we are at a pivotal time, too. I know everyone's watching real close. Because we're opening businesses back up, right? So we really want to watch the numbers over the next couple of weeks, right?
Yeah, and it's excellent that we're able to get so much more testing because now we're able to isolate. We can really get people to sit these ones out instead of just saying, you know what, you have a couple of symptoms, the entire system is out. Now we're able to say, all right, you have this, you need to self-quarantine. We're able to kind of do this a little bit more focused as opposed to a shotgun approach, which I think is going to be much more beneficial for not only the economy, but also for everyone's health.
And we're beginning to see now that the contact tracing is beginning to pop up here in Michigan. Another big thing we said, we got to get the contact tracing, we got to get the testing to be able to open things back up. That's happening. A big contract given to one of Dan Gilbert's companies, and they got the big phone centers and all these people. Why not? Already set up for it. So the state is contracted with them to start doing contact tracing, and that should help as well. So those are the two things, right? Testing and contact tracing that the medical community wants to see, correct?
Absolutely. And I'm hoping that this will help kind of guide care a little bit better rather than allow people. The one thing I worry about is that people will get this false sense of security that, hey, we have it all under control and everybody just goes back to business as usual. I think they need to really just be concerned that there might be another wave coming through. They might need to kind of take this information that they receive and just be cautious with it. That's all.
Well,
but I am excited that things are starting to slowly roll back into play. And I'm glad that we have all of these things in place that we're able to really control this to a reasonable degree, where we're able to just get the information that we need to prevent this from becoming a complete disaster. So I'm optimistic. I'm very, and they're going smoothly. I mean, we're doing a lot more testing specifically in my office. We're starting to see patients, and so things are really starting to kind of pick up. We're still doing telehealth for those that do have those concerns, and I encourage patients to not avoid getting things looked at either via telehealth or otherwise, as long, just because they're concerned they might catch COVID. We're really, the healthcare system is really working hard to mitigate any risks. So, don't want things to go unheeded.
No, and we're hearing that the hospitals and the medical facilities are doing a great job making sure that if you go in and you're going in for something other than COVID, that you're going to be safe. It's going to work out okay, and you're going to be fine. So, no, we want to encourage people to go in and get that treatment. And part of it too is just the survival of your industry. The docs are business people too. The hospitals, as everyone knows, losing a lot of money, haven't been able to do the elective procedures, and they're going to get some relief from the federal government, money coming, but it's smaller offices like yours really that have a greater challenge economically. You got to get up and running. How's that going in your office and your colleagues around Michigan?
I can't speak on the colleagues, but as far as just personal experience, my office, we've reopened. We're having limited appointments for kind of, we're spacing things out because now our turnaround time has got to be a lot slower because we have to accommodate for the fact that we're completely sterilizing the room from top to bottom between each patient. And we had to reset up plans in place. You can't come into the building unless you are screened for COVID in terms of just a questionnaire. We take your temperature, and if it looks like you might have it, then I come out to the parking lot and I will do a nasal swab on the spot, send that out, and you have to self-quarantine until you get results. Otherwise, if you do pass and you come in, then you get put in a room and we get to do all of the fun stuff while we're still doing telehealth calls. So it's slowed us down considerably, and we're trying to slowly roll back in and get into this groove. But with the amount of things that we have to adhere to, it's definitely we're taking a hit.
Yeah, it just cracks me up. Drive-through medicine has come to Michigan, but no, you're not the only one to do it. It's cool. So you put your sneakers on and you're running around. You're probably getting all your steps in right now, Doc.
Exactly.
So that's good. So
in a few months back.
Yeah. Our Larry Nyland, who you talk to before you come on the air every day, he's our Zoom producer. And Larry does a really good job taking care of his health and always on top of it. So he went out and he was tested, and I don't know if you talked to him about it before he came on, but Larry was tested, and he had the two tests. So it seems that's what's going on in a lot of places. He had the antibody test, that's the fingerprint prick test, and he had the nasal swab test to see if he had active coronavirus. Those, I assume, are the two big tests, correct?
Yes.
Okay. So he had both of those, and then Larry was disappointed because he came back negative on both of them. Seems like people are rooting to have the antibodies right now. Is that crazy or what?
It is a little bit. There's still, the jury's still out as far as whether or not you've had exposures to this, whether or not you still can't get it again. There's, it takes a little bit of time. There are still false negatives. I think the nasal swab has a 40% false negative rate, 30 to 40. The antibodies is still a little bit, has some false negatives, and it's also not 100% accurate in terms of this, and the timing of it becomes a bit of an issue. But Larry should be relieved. He hasn't been exposed to it.
He should be. Larry is our resident hypochondriac. He admitted that himself on the air. So, well, you just made news again, and I'm sure other people have talked about it. I read as much as I can every day. I've not seen. I mean, I knew there were a lot of inaccurate tests, but I didn't know the number was quite as high as 30 or 40% on the nasal test. That's a big number.
The nasal, yeah, because a lot of it's also operator dependent. Are they able to get, I don't know if you've had that nasal swab. I'm sure Larry can tell you. They pretty much, it's almost like they're touching the back of your sinuses with that. It's not a comfortable test. It's not painful. It's just uncomfortable. It's an odd feeling. But it can be operator dependent, and they have to go in there and really kind of get that. It can be up to 30%. So, guidelines at least from the infectious disease expert that I consult with, recommends even if you're symptomatic, regardless of a negative swab, you should consider that patient to be COVID positive. So if you're still having the fevers, the myalgias, the difficulty in breathing, the shortness of breath, the headaches, things like that, you consider COVID positive unless, until the symptoms are gone for a minimum of 72 hours.
Anything new on the treatment front? Obviously, the big news, I think, a week or two ago was remdesivir, and that is supposed to be helping a lot of folks. Anything new on the treatment side that you're aware of?
No, the remdesivir is starting to work a little. Those studies that are coming out are positive. So they're now giving amounts of remdesivir to local hospitals, is trying to ration it out as best as possible to, again, reduce the length, to kind of shorten that time that the patient's in the hospital, which is excellent for regards to resources, so that patients aren't going to be in the hospital for longer periods of time. The quicker you can get home from the hospital, the better you are for everything, including the system. And I think this curve is flattening so that the healthcare systems are no longer as overwhelmed. They're still taking their hits, but I think it's improving to a degree. I think we're now coming to a good point where we have very good plans in place. So businesses are starting to open slowly. And I was excited to be able to get my coffee. So
I know. Hey folks, take a look on TV. I got my Starbucks right here. So yes, we are moving on. I heard, I think Starbucks is giving out free coffee. I got to be careful what I said, because I said the wrong thing. Can I say this? Is this true? Is it true that they were?
I don't know.
Did you pay for your coffee, Doc?
Sure.
I'll just ask you that. Did you get a free coffee, or did you pay for it? You paid for it.
I paid for it, but I used the app before I even got there. I just, ran.
I heard they were at some point that Starbucks is handing out free coffees. I don't think they're doing that anymore. And I don't want to get on the air and say that, because I'm going to get in trouble and send 1 million people to Starbucks, and if they are like a first responder or something like that.
They were for a period of time, but at that time, none of them were open. I don't know about now. I know Big B is as well. Big B has been really good about giving, if you're a healthcare professional, they were doing that for a period of time as well.
Doctor, thank you very much for joining us on the show, as you have so many times. Thank you so much for your service to the community. If people are interested, because they've gotten to know you after a while, like we have now, they want to, maybe come out and have you become their doctor, what information can you share with us so people can find you?
All one word, grandrivermedical.com, as well as, can call my office, 248-264-6169. I sincerely appreciate you allowing me to say that. And thank you very much for having me on. As always, it's always a pleasure to talk with you guys.
Well, pleasure is all mine. Final question, any prescription for our listeners and viewers today? Any final tips and how they can avoid this whole mess?
They're doing great. I think they need to just continue with this. I feel like people are feeling that this is starting to ease up a little bit and their guard's kind of coming down. I would advise them to please keep the guard up. Please continue the social distancing. I'm not saying you need to stay in. I'm suggesting that you continue to wear the masks, but I do want to see people doing things. I do want to see people getting out, but just as long as they're adhering to rules and continuing this, I think we'll be just fine.
It was funny yesterday. So we had the fire chief of West Bloomfield on, and he pulled his mask down under his nose. The people are pulling their mask down. They're wearing the mask, but then it gets hot and uncomfortable because everyone's wearing them in the stores now. And then they pull their mask down and expose their nose. He gave it a term. It's called facial covering displacement. Nada, no good. Don't do it. Not going to happen. That's not it. Then the mask doesn't work, right?
No, it doesn't work at all. You're basically
right.
Not doing anything.
Might as well not even be worried. Not even worried. Do not get into facial covering displacement. That, Tyler, would be an FCD. That is no good.
Oh, yes,
right?
No.
Thanks, Doc. Appreciate it. Good talking to you. He is Dr. Jaime Taweel, and you can find him at Grand River Medical Associates. And even if that's not right in your neighborhood, it's worth a drive. He's a good guy.